Thank you so much. I see folks still joining. As you're joining, I know I sound like a broken record for those of the folks that have been on since the beginning, but please enter your name and your organization's name in the chat and we can go ahead and get started. Welcome back. Happy first day of summer. I think today is the summer solstice, so longest day of the year. I hope that you all don't fill it with work hours. So just a reminder, meeting logistics, we record these sessions and we do take roll call for record keeping purposes. If you're on Zoom, please, we encourage you to share your video. It's always nice to see some familiar faces, but it's not required. If you're not on video, please make sure that you have your name and your organization's name in your slide or in your Zoom. If you don't know how to do that, you can click on those three little dots when you hover over your picture, and you'll see that you can update your name with your name and organization name. Okay, let's go ahead and get started. Lauren, if you want to go right over to slide 3. Yep, so a couple of other things, meeting logistics and our collaborative agreements. So we talked a little bit about this last month. We'll talk a little bit more about it, and we'll continue to bring it up in each of our monthly meetings. So, you know, we do a lot of collaborative work in these meetings, and we want to recognize that everybody is coming at this work from different spaces and different lenses. And so really being mindful of how we engage with one another and participate in some of these active discussions. You can go to the next slide. Well, we talk a little bit about, these are our collaborative agreements that we've solidified last month. And so really thinking about that when we get into the activity session today. For those that are new to the meeting, my name is Denise Denoto. I think probably have enough of a group where we can do some introductions, but really quick, I'm one of the facilitators for this collaborative. I'm joined with a few members of our team. We have SoKim. SoKim is on the line. Lauren Wood. Lauren P, I see your face. Can you hear us? Okay, I saw you join and then drop off. And Danny. Danny Carter is the executive sponsor for this project. So, okay, so welcome, happy Wednesday, summer solstice. We'll talk a little bit about what have we done so far this year, and what is our plan moving forward. And then we're going to hand things over to Rebecca Long. Rebecca Long is going to share some information about WIC and about some things that are available in the community. And again, like we said before, we want to make space in these meetings for community spotlights each month. And so if you are interested in participating and providing some additional information about your organization, let us know. And we're going to work over the course of the next month to start to fill our docket for the remainder of the year. Okay, then we'll get into our activities for the day. We'll talk a little bit about measuring the network and what that looks like. And then we'll start to think through those priority areas of focus. And I'll talk a little bit more about that further on in the presentation. Okay, next slide, please. Really quick instant replay from May. We looked at the prioritization Google Sheet. So for those of you who are newer to the meeting, we've taken work that we've collected and tried to build on that work each month. And so from our initial registration to feedback that's been happening in some of our monthly meetings, and start to think through areas of focus. What do we want to do together? What are some of the things that we'd like to focus on? And then drill down a little bit further on how we might want to prioritize those activities and plan for different tests or changes that might help make a difference in that focus area. In addition to our monthly meetings, we have coffee chats. They're a little bit less formal and they're a little bit more discussion based. In May, we went back to those priority areas of focus and tried to drill down a little bit deeper into different aspects at a more granular level of what some of those priority areas meant to the community partners and what a change would be in greater detail. We also still have that Slack channel for those of you that are looking to crowd share information with collaborative partners. If you don't already have access to that Slack channel, we'll include that when we send out the materials from today. And again, this is a reminder of why we're here. This is a slide that'll stay in all of our presentations from now into the end of the year. And really thinking about this CalAIM, bigger picture, and then also our aim, which we worked on in the beginning of the year, which is really thinking through our overall goal in a way that we might be able to measure our engagement throughout the year. And the work that we do in each of our meetings really kind of ties into and supports that goal in one way, shape, or form. Next slide, please. Just a reminder, this is the aim that we worked on in the beginning of the year. And then if you want to go through, I think the next slide shows a little bit of a visual about where we are today and where we started and where we're headed. So in year one, we're really looking at increasing contracted providers and improving referral pathways. How can we increase something that we don't necessarily have a baseline for? And we'll talk a little bit more about that. And then we think about the how, right? So if these are some things that we want to do or that we think that we need to do collectively in order to increase those eligible individuals enrolled in services, how are we going to do that? And what are some of the different things that we don't know today that we need to find out? And what are some of the things that we do know today that we would like to change? And what are some of the things that are happening today that are really great and that we want to share from a best practices standpoint with each other? Next slide, please. Oh, the automation. See, I know I didn't do these because I'm not good at that automation. Okay, so our community spotlight today, Rebecca, I'm going to pass the mic over to you for an introduction. And while you're introducing yourself, we'll bring up your slide, or you can bring up your slides.
Perfect. Thank you so much. My name is Rebecca Long. Like they said, I'm a senior public health nutritionist with the Contra Costa County WIC program. I just transferred over from the Brentwood office. Now I'm at San Pablo, so I've got a little experience in a couple of our clinics. Let's get my screen pulled up. Okay. Perfect. So just to get started, we'll just be talking a little bit about what we do at Contra Costa County WIC. I'm sure some of you guys have heard of our program, but just a little bit of the basics. So who do we serve? WIC stands for Women, Infants, and Children. So we do work with babies, children under the age of 5, pregnant women, and new mothers. And what we do is we provide nutrition education, both in individual and group classes, and that really allows us to give practical nutrition information and everyday healthy living tips for our participants and their families. We have individualized nutrition counseling. So we have nutrition experts who specialize in nutrition for mothers and their children. We do have breastfeeding support and resources. So a lot of support and information about breastfeeding for your baby, including access to our breastfeeding experts and supplies. And then we also do a lot of referrals out for other healthcare programs, specialty dental care, housing assistance, food assistance, childcare, things like that. And then we also have our WIC cards, which provide our monthly food benefits. Unlike EBT, where it's a cash amount, it's more specific foods. So it's a certain cash value benefit for fresh fruits and vegetables. They get a certain allotment of whole grains, milk, eggs, breakfast cereals, juice, peanut butter, things like that. So kind of specific food benefits that they get each month. Here's just a little bit of a look at what our caseload looks like. This is from May. There are 84 different WIC local agencies that contract with CDPH to deliver services. And California actually does have the highest state coverage rate of helping people who are eligible for the program. Our coverage rate is about 65% for the state of California, and the average is around 50%. So we do a pretty good job in California, kind of getting all of our, or a lot of our participants joining the program. A little bit more into our numbers. So we do have 5 clinics, more so 4 main clinics and then 1 satellite clinic. I'm sure you can see which one is going to be our satellite clinic. So we have San Pablo, Pittsburgh, Concord, and Brentwood that kind of run out of our healthcare systems or our healthcare clinics. And then we also have Crossroads, which is kind of our clinic, satellite clinic at a high school that helps a few, mostly high school students, high school mothers. So this is kind of our caseload, and as you can see, we're helping around just under 20,000 participants in our county. All right, and then what happens once you start receiving WIC benefits and services? So WIC is the best place to be when you're having a baby or having young children. Staff are highly trained in nutrition, lactation, and a range of topics pertinent to young families, and each participant receives a comprehensive nutrition assessment that determines not only any nutritional needs, but also any health issues such as tobacco use, housing security, and behavioral health. The nutrition education that we provide is participant-centered and uses motivational interviewing, which really, kind of goes to show our higher standards and investment in our staff training. And then WIC staff also provides participants with referrals if needed that are identified during our initial assessment, as well as any of our follow-up visits. They do typically are on a quarterly basis for our follow-up appointments. So they recertify each year. And then throughout that year, they will typically have 2 classes and 1 mid-certification. So kind of each 3 months, we will check in with them. And then obviously, if we have people who are needing a little bit more check-in, a lot of our higher risk participants or infants do need a little bit more check-in. So we kind of use our judgment to kind of follow up with them as needed. And then also there is really a focus on the whole person with trauma-informed care and what we do. Just a little bit about our staff. So WIC nutrition assistants make up a bulk of the WIC workforce. They complete very thorough training that takes about a year to complete. We also employ degree nutritionists who have completed a 4-year degree in nutrition from an accredited college or university. And then we also have our registered dietitian nutritionist, which in addition to that 4-year degree also requires a 1-year internship and a national registration exam to become a registered dietitian. And we must complete those continuing education credits to kind of maintain our standing. And in 2024, all RDs are going to be required to have a master's degree as well. So that's kind of going through, what kind of nutrition experts we have. And with our nutrition expertise, we are able to provide really good individualized nutrition counseling services for all of our WIC participants. As I did mention, we do have some kind of higher risk participants. That's going to be any of our moms or adults who have things like diabetes or high blood pressure, any other kind of medical conditions. A lot of our infants require special formulas if they're either premature or if they have certain allergies. So kind of most of our dietitians are kind of working with those higher risk participants as well. And a really big focus is kind of early childhood overweight and obesity assessment, and counseling is a really big part of our responsibility here at WIC. We also provide our lactation services. So we employ all levels of lactation staff, including peer counselors, lactation educators, and our board certified lactation consultants. These consultants, like I said, they're board certified, but they also must maintain continuing education throughout their career. And the USDA provides extensive training for these lactation experts on our WIC staff, for our WIC training, and introducing a new curriculum. We are coming out with the new curriculum. We're actually in pilot testing right now, so trying to get a little bit better curriculum to kind of get our training a little bit more up to date. So each WIC staff will assess each participant and each infant for adequate and appropriate feeding. We do provide support for any moms who are in need. We also have our, as I mentioned, our breastfeeding peer counseling program that will kind of automatically go through and screen all of our participants, specifically first-time moms are kind of flagged to be helped by our peer counselors. So kind of, looking at our files and seeing, where those needs are and kind of trying to provide that extra help and support as needed. And then we also provide breast pumps. For those who are eligible with Medi-Cal, we can order those breast pumps for them and they get to keep that. But otherwise, we can have our supply of breast pumps throughout all of our clinics, so we are able to kind of loan them out with all of our participants as well, kind of just based on a priority and what their need is at that point. All right, and then overall, a referral to WIC is a referral to wellness. WIC is local and statewide. It's built on prevention and wellness promotion, and we really focus on equity and the participant experience. Overall, WIC is really community driven and family centered. We work with a lot of trusted and experienced community partners, and it's proven to reduce healthcare and social service costs. Some of those healthcare and social service costs are reduced preterm and low-term birth weights, reduced anemia and blood lead levels, and reduced obesity in 2 to 4-year-olds. With weight, kids and families are also eating more fruits and vegetables, and breastfeeding rates have improved, and families are supported to stay well and prevent disease. These are just some of our many outcomes that we have with WIC, but we definitely are kind of noticing these great impacts that our program is having on our communities and our families with WIC. That is pretty much all I had to share with you guys today. Obviously, if you have any questions, I'm happy to answer. I did provide kind of the link for our website if you wanted to check out a little bit more about the local agency and our program. And then also I did attach our the contact information for Roz. She's going to be the director of the county WIC. So if you do have any more specific questions, you can always direct them to her as well. All right. Did anybody have any questions at all, or?
I have a question. Does WIC do ECM? Is that like considered ECM as under CalAIM?
I'm not sure. To be completely honest, I just kind of got into the senior position, so I don't know too much behind the scenes. I'm gonna be honest, I don't know what ECM stands for.
And so ECM, Enhanced Care Management Services, and I want to say, Sarah, it's community supports services and not ECM, but don't quote me on it. I'll confirm. But I think most of the WIC services align with community support service offering.
Right,
anybody else?
Because you have kind of a case manager when you go to WIC, which sounds like ECM to me.
Yeah, we don't have necessarily one specific person that's following up with each participant. We kind of will shuffle along. Like I said, dietitians do need to be seeing kind of our higher risk participants, so those people are followed up by the same. But generally, it's you're calling, you're getting different people doing your classes, different people doing your counseling and stuff like that. So you don't necessarily have one person that you're working with our program.
Mm-hmm. And is there like an intersection between WIC and CalAIM right now?
That's a good question. Again, honest, I'm not completely sure on CalAIM on that.
That's okay. As someone from Contra Costa Health said yesterday, CalAIM is a savage wilderness. We are all navigating our way through it.
Okay. Good to know. I will follow up on that one for sure.
This is Tara Berkey from Anthem, and I just put in the chat some ECR core service components that I think might be more intense or more hands-on than probably some of the services that we just heard about.
Thank you.
Yeah, that's a good point. So, hi everyone. For those who don't remember me, I was part of the earlier sessions, and I'm on Denise's team, and have been following Colleen closely. So, so that's right. So ECM is just not enhanced care management. The Department of Health Care Services, who is administering CalAIM for the state, has some distinct core services as part of ECM, enhanced care management. And one of the areas is comprehensive, conducting a comprehensive assessment and identifying family and social supports and transitions of care. So there are really in-depth enhanced care management components to that service. So Sarah, I mean, that's a really, important distinction that you're calling out. And I think in a lot of, it does sound like it's more aligned with community supports because of the types of services it falls under. We'll have to find out if they're contracted with the health plans to see if they're officially a community supports provider, but it sounds like that would be where they would most likely fall under, just based on the types of core services that would categorize them under ECM. But it's true that we'll find a lot of community support provider types who provide care management as part of their role. So this isn't going to be the first time that we're going to have to do some thinking around these types of services.
Thank you, So Kim. Yeah, and also Amy, there is other areas across the state, and so we can think about a way to bring that back to Contra Costa, where WIC is participating in a really active role for ECM and community supports. We've seen some WIC service providers who are also FQs, and under their FQ delegation, they're providing like ECM services. And so they're offering ECM services, and they also are providing WIC services, some of which fall under community supports. So it's a little bit murky, like you said, with regard to CalAIM, but there is definitely an alignment depending on the specific services and also the contracted provider. And then I'm wondering, Lauren, if you wouldn't mind pulling the presentation back up. And then while that's happening, Rebecca, what we'll do is we'll share your contact information, but we'll also circle back with this group and send an update via Slack, just some additional both local and state WIC services and how they tie to CalAIM.
Awesome. Thank you so much. And yeah, I'll message my supervisor and try to get those answers regarding it. Does not look like we are ECM. I was kind of looking through those guidelines you were sharing. Yeah, it does not look like we're ECM, but I will try to get to the bottom of that and send that in that response email as well.
Wonderful. Thank you so much for that.
Yes.
I just want to call out what Amy said in the chat. And so that is a good point, that the ECM population of focus for youth and children are going to be included, starting next month. So, but that's, there's a distinction between that and community support. So if this falls under community supports, those services are already, underway under that type of service.
Thank you for that, Sokim. Next, we'll talk a little bit about priority areas of focus, and to some degree tied to a little bit of our conversation, ways in which we can look at the network and the service area and develop a baseline and get a better understanding of who are the ECM service providers and who are they contracted with, and who are the CS providers, and who are they contracted with. And we've done a little bit of this before, but we're going to look at doing it in a little bit more of a different way. And I'll hand things over to Danny to talk a little bit about the network assessment in more detail. And then after that, we're going to get into our second activity, which is circling back with those priority areas of focus that we talked about in previous meetings, and think through some next steps, and then vote on, not really our number one priority, but really based on the information and the discussion, the next item that we think that we're going to be able to advance just based on feasibility and discussion. So we've already sort of established these as priorities from a collaborative discussion. And we're going to think a little bit further about those priorities and talk about pros and cons and the likelihood of us being able to really work, roll up our sleeves and work on these things together. Okay, next slide, please. Thank you so much, Lauren.
So I can jump in and I'll caveat the whole thing with my 5-year-old's homesick, so you might get a cameo of him sometime during my talk. So I just wanted to kind of reflect back on some of the conversations that we've been having over time. In the coffee chat last week, I think it was last week, we were talking about, the need to better understand provider capacity for contracted providers across Contra Costa County for ECM and community supports, and also the need to understand specific populations of focus, not necessarily ECM populations of focus, but does this particular community support provider focus primarily on African American women or the LGBTQ plus community? So really kind of understanding a little bit more granularity about the services that they provide and to whom and in what geographic locations. So that was part of the conversation that we had at the coffee chat last week. We've also been having in other one-on-one meetings similar conversations about needing to understand the broader network, as well as the network of providers that are not yet contracted for community supports, but want to be in a couple of different community support focus areas. And then the stars aligned, and we heard from DHCS last week that they're also looking to the CPI collaboratives to collect and provide that type of data. Really understanding kind of at the aggregate level what contracting relationships look like in the communities, as well as starting to look beyond the contracted relationships and look to those organizations that are interested in contracting. So all of that to say, one of the things that we would like to move forward right now to help us understand that baseline is do a little bit more of a comprehensive landscape assessment that meets the needs both of what we were talking about in the coffee chat last week, as well as what we're hearing from other key stakeholders and the state of wanting to understand the span of providers not yet contracted that want to be. We plan to do this network assessment in 2 ways, primarily collecting data through a web-based survey. And then as needed, we'll set up one-on-one meetings, especially for providers that are not yet contracted or not yet within kind of the CalAIM world. They may not know necessarily, they may not fully understand the jargon that we're using, or really they might have questions about what it means to be an ECM or community support provider. So we can set up one-on-one meetings in those cases as needed. Next slide. So what we've done to help move this forward is that we've drafted a survey and we will be putting it into an online survey tool. So that's done. The questions are really focused, as I mentioned, they're focused on understanding whether or not you all are contracted providers. If you are, who are you contracted with, for what service, ECM, community supports, what population of focus, what specific community supports. And then also to understand, for those that are not yet contracted, are you interested in contracting, for what service, et cetera. There are also questions that we added in to be responsive to the conversation in the coffee chat around geographies being served and some other details getting a little bit more granular about some of the services that these organizations provide. So we've drafted that survey. What our ask is for you all who are joining the call today is to pilot that survey. So we'll be sending it out after this meeting. And I would love if you could fill it out, one, because that would give us the data about you all and the services that you provide. But it also will help us understand, do the questions that we're asking, does it meet the needs that we were talking about in the coffee chat? Does it get at the level of information you're looking for understanding, truly understanding the network in Contra Costa County and understanding, who are your colleagues and peers in this space? Who can you refer to? What's their capacity, et cetera? Are there questions that are missing? Does the flow look really funny and it just doesn't make any sense to you? So these are all things that we're interested in understanding before we pilot this or before we share this out more broadly across Contra Costa County. So we've drafted the survey. We'll be sending it out to this group after this call, and we would love if you could pilot it. And if you would be willing to do that, if you wouldn't mind putting in the chat, yes, you're willing to pilot, just so we know that we have a couple of people that are willing to take a look at it, fill it out in real time, give us, the true accurate information about your organization, and then also any feedback that you have on what we're missing. And then from there, after we finalize the survey, we want to send the survey out. So we have a list of, Denise, do you off the top of your head know how many people are part of the CPI listserv? 100 or so?
I think just under 100, yeah.
So we have a list of 100 or so folks that have signed up to be a part of the CPI listserv in Contra Costa County. Some of them have attended these meetings over time. Some of them haven't yet started attending. But we know that that's not everyone, especially not the non-contracted providers or the people that aren't yet into this CalAIM world. So we would love to hear from you if you have contacts or organizations that you know of that are interested in providing services. Who are your peers that you've been talking with that might be interested in learning more about CalAIM and contracting for specific community support services or ECM services? It would be good for us to know that as well. So we would love to hear from you, who those folks are, and we can then send the survey out to them. We're also drafting communication language to share with you. So if you would prefer just to send the survey yourself, hey, I'm a part of this meeting. We're trying to get a better understanding of what the network looks like for certain services in Contra Costa County. Would you mind filling out this survey really quickly? There's no, because they fill out the survey doesn't mean that they have to join CPI. It really just helps us to start to gather some of that information. So we'll be drafting some communication material. If you all have those colleagues and contacts that might be helpful to fill out the survey, we ask either you send it or you send us their information and we send out that survey. We also know that there are a couple of other collaboratives across the county that are meeting that it might be good to share the assessment with them. So, thinking top of mind, there's a COC collaborative meeting, or at least grouping of providers. It would be good to get the survey over to them so they can distribute out to their network. So basically what we're wanting to do is to kind of snowball getting this survey out by leveraging the relationships that you have that we might not yet have. The idea is over the next month or so, folks would fill out this assessment, this survey, and we would start to get a base understanding of what that full network looks like, both in terms of who's contracted as well as who's not yet contracted but wants to be, and then starting to get an understanding of capacity across the county. We'll then update in some way. I think that there's still a question mark of exactly what the visual will look like, but we'll in some way update the provider network map that we've already started to draft and share that back out with you all as collaborative participants. This, I think, is an introductory activity to some of the other activities that you've all flagged as potential next steps or priority areas to focus on over the next 6 or so months. So hopefully this will be the right base information to then use to determine what's next. How do we continue to use this information to make actionable next steps? So I will stop talking at you, and I'm curious, does anyone have any questions, comments, or concerns? Is anyone willing to pilot this survey? Sarah, thank you. And I should,
Can you talk a little bit more about what it would mean to be a part of the, the pilot to
yeah.
test the survey?
Yeah, so in being a part of the pilot, we would share the link out to the survey with you before it goes out broadly. And basically what we would be asking is both for you to fill in the information for your organization, so we have it, as well as for you to provide any feedback to us around, what is the flow like for this survey? Is it really clunky? Are there changes that need to be made? Are there questions that are not being asked that you are curious about across the community when it comes to the network and the capacity? What do we need to add in? What do we need to take away? So it's really just kind of giving us an overview and look of the feedback that you have. As well as filling out that information for yourself and your organization. Rachel, I see you're willing to pilot. Thank you. And then I will just say we are being asked from the state to provide information on, for those that are attending the CPI meetings, are they contracted? Are you contracted with ECM, for ECM or community support services? With whom and for what? So that information we will be looking to get from you all. So I just say, even if you're not going to pilot the survey, we will be asking you to fill out the survey for your organization as well, just so we can get that information back. It also will help with the general landscape assessment and network map that we're crafting. Any other questions? That's fine, Hannah. That would be it. I think it's helpful information to know anyway. So, feedback that you have, but then also, are you interested in becoming a provider at some point? Are you even eligible to become a provider? If not, then that's great, but it's good to know that you're a part of the network in general and some of the services that you offer, the kind of global network.
Yeah, Hannah, you represent some of the stakeholders that we actually want to hear from. So we're not just wanting to hear from ECM and CS providers. We want to understand the entire network. That's what everyone is interested in. So you're it's great. Thank you for being willing to help us test this out. And if there's any language in there that you think we should modify, if there's a better way to ask a particular question, or if there's anything you want us to elaborate on or define in order to get more accurate responses, please let us know that as well. Because we live in the CalAIM world, and sometimes we forget that not everyone, understands what ECM is, from the example from today. So we'd love any types of feedback like that as well. So thank you.
No problem. Sounds good.
And then just one final point of clarification, when we're talking about a network map and a landscape assessment, I think it's within the safety net. So while it goes beyond CalAIM and community support specific services, we're still kind of looking within the safety net to build out that assessment and landscape. Okay, well, at that, Denise, I will turn it over to you.
Thank you so much. And we'll head over to the next activity. And so we're gonna talk a little bit more about 3 of our focus areas. I encourage all of you to come off of mute. And we wanna have just a really engaged conversation about some of the topics, and then some ideas of activities and next steps for us to work on. So really quick snapshot: equitable payer and provider relationships. So over the course of the last 6 months, we've been collecting and talking about different ideas and different pain points and different opportunities. And so we categorized those thoughts into a single document, and then we started to put like comments and ideas and priorities together. And then we've tried to, over the course of the last couple of months, thinking about that work in a way to prioritize some of the initial areas of focus. And we'll talk about, what does it mean? Okay, yeah, if that's important, why is it important? What don't I know? What do I need to know? Who do I need to work with? Who do I want to work with in order to do something about it? And so that's sort of it in a nutshell. And the first one, equitable payer and provider relationships. The first idea and the priority that's been discussed is hosting an internal site that provides details, including service capacity, data, other types of information, method of referrals, technology, contact status with managed care plans, etc. So aligning with that network assessment to establish some baselines and to start to think about that area of focus. The next thing that we talked about last in our coffee chat was, what does that mean? What would we need to do in order to get that? So would we want to establish a work group? How might we identify a pilot group of individuals? What's the frequency in which you'd have to update your information? Do you have a person even on staff that would be able to do that at a frequent basis? So really thinking about testing workflows, frequency, and impact. And then last but not least, certainly, is explore funding opportunities. It'd be great if we could do this thing, but this thing costs money. And so really kind of understanding how all of the pieces and parts fits together. Before I go into the next priority area of focus, I'm going to invite my colleagues to share and ask questions of this group, and for this group to kind of discuss this a little bit further.
Yeah, so I wanted to provide some more framing after Denise presented the first priority focus area. So what we're hoping to get to today is a decision on what this collaborative will be focusing on. So as Denise mentioned, the last several months have been structured so that we would identify an aim and all of the potential work that could be done to get to that aim of increasing ECM and community supports in the community. So that's a big overarching goal, right? But how do we do the work? And so we took you through this very extensive process of coming up with a bunch of ideas, and then now we're narrowing it down further and further. And we've narrowed it down to one priority that you all prioritize under each of these categories. So equitable payer and provider relationships is one of those categories. And under that, you all identified this, hosting an internal site with the information that we're going to start to gather from the landscape assessment we just talked about, like who are the service providers, who's interested in being a ECM and community supports provider. That's the starting point. But there's been a need or a want to have this data collected and updated on an ongoing basis. So this is what this is all about. And so we're presenting one priority in each of the categories. So this group, so this is actually a very critical meeting that you're all participating in, and that out of all the important priorities, they're all important because you all identified, these are all of the areas that need to be addressed. Since we can't work on all of them, we need to select one or two. So we're Denise is going to walk us through the next couple of slides, and then we're going to come back and have this group select which of these priorities this community should start doing real work around. And so the next step ideas, as Denise walks through them, is really supposed to give you all a sense of what the work is actually going to be like for your organization, if you end up, participating in this effort around this area. So really think about if this is an area that's important to your organization, and what the work is going to actually look like as we, over the next 6 to 8 months. So, and these next steps are just ideas. If you have any other next step ideas, feel free to share that as well. But this is just to give you a sense of what the actual work might look like. And if it doesn't seem feasible, take that into consideration. We can change the next steps, or we can choose a different priority. So really, we really are hoping that you are taking in what's being presented here, and thinking about how it could potentially help your organization reach the aim and implement ECM and community support successfully, and also, provide input in what the actual work would look like. So just hopefully that's helpful full framing, and I'll just pause and let others chime in on this specific one as we talk through each of them. I see some comments in the chat. Okay, this is related to the survey. Okay, any thoughts or questions from anyone about what we're trying to do here, just, as we go through each of these priority focus areas, or anything specific to the one about hosting this internal site for this information? Any positive or reactions or concerns related to this? We won't be voting until the end, so this is just sharing thoughts.
Hi, good morning. This is Jonathan. Just
Okay.
curious, and I'm sorry if this is a silly question, but I just want to understand, what is this, what is the goal? Like, what is this trying to solve for? I imagine maybe providers have brought different scenarios and pain points, and can you share a little bit about what this is trying to solve for?
Yeah, I can start from what I've heard, and then the Intrepid team can add anything we've missed. And if anyone has any other perspective that we don't talk about, please share. So we've heard from the just managed care plan perspective, it's helpful to know, the managed care plans obviously know who's currently contracted. They're the ones doing the contracting. So there's less of a question around that. It's more who is interested in being an ECM provider and community supports provider, and who has the ability to do so, who has the capacity, who has the funding. So that, in summary, is what could potentially be helpful for the managed care plans. And from the community provider side, where that is helpful is who can they refer to? So an ECM provider would love to know who they can refer these members to, these beneficiaries to, for services that they're not currently providing themselves, and community supports providers that they can connect to who are providing community support services. So it's more around the capacity aspect. So it's the intent and the benefit varies depending on the perspective. So if anyone has any other perspectives in terms of how this could benefit them from your organization, feel free to chime in. Like how would having this information, capacity, and contracting status with the NCPs, how would that be helpful for your organization when it comes to telling?
Jonathan, I just put in the chat too, the Google sheet. So in addition to what you see here on the page is a bunch of notes from different breakout sessions. So it kind of ties some of what you were describing, like the pain points. Wouldn't it be nice if, I wish we could do this. We're struggling identifying a specific provider or a specific provider that works with this type of client. So demographics and that lot. So we have our raw notes from previous meetings, and then the translation into, I wonder if we could create this thing. In this case, it's an internal site that streamlines or provides data relating to capacity and method of referrals and contracting status.
Thank you. Thank you. That was all really helpful. Yeah, I think understanding provider capacity and defining those referral pathways, and I have X number of patients, which provider can serve them, like has the expertise to do it and the actual capacity to be able to take on an additional caseload. So that makes a lot of sense. And just, I think this is a thing that, you know, I participate in a couple of other collaborators across the state, and this has been a thing that's been around since the Cali collaborative days. There's been a huge kind of black box of information from providers about understanding who the other players are in the field. And I know that some of the concerns that have been brought in the past was like, this is a great idea, but how do we make sure that it becomes and stays as a live document that's accurate? Like, who's going to be responsible for like maintaining that, and how do you create like a system of information that isn't too onerous for people to continue to maintain? So I'm curious to see like what ideas you guys have to like create a process around this. And I see the value in it, and I think providers can also benefit from it as well. So thank you for sharing. That's really helpful. And I'll look at some of those past notes as well. Denise, thanks for sharing that link.
Yeah,
Denise, can I just, sorry, I just wanted to offer kind of like within that same context, I think also just kind of in having all these conversations, just also being able to reflect, you know, through moving these workflows forward, these different priorities within the context of it being a transitioning county. So Anthem is leaving, and so how, you know, that's kind of reflected and kind of like kind of making something a sustainable living document the systems are setting up, and just really you know, so just want to put that out there for framing as we're thinking through some of these system setups.
Yeah, that's a perfect point. So part of the work, if the group decides this is, you know, important and valuable enough to, you know, make happen, thinking about who's going to host it, who's going to manage it. And, you know, there is funding available to get things started, but part of the work is figuring that out, getting that started, and then maintaining it where it's going to live, and how to make it, you know, simple enough where it can be updated relatively in real time. So hopefully that gives you a sense of how valuable this is, but also the work that will be required, and some of the, you know, complex thinking that will be involved in order to, you know, to really make this happen. So thanks for bringing that point up, Ilana. And
I think too, just to piggyback on that, and maybe Lauren P, if you want to share some thoughts, but it isn't that we need to come up with a solution, but we've identified an area of focus. So Jonathan and Ilana, to your point, there's a lot that we should consider. It's not that this is an easy thing to check off the box. What we're saying is there's a certain level of interest, and we might be able to work collaboratively to do something, maybe create a pilot, maybe a non-technical solution, maybe just working with a few providers who really need to lean on each other, and where capacity for one another is really important, and talking through a way that we might be able to simplify some of their workflows. That's one idea. So I'm just spitballing here.
So I think unless there are other thoughts and comments, and we're going to come back to this, so this isn't the end of this conversation, but I think, Denise, we can move forward to the other two priorities that we're considering, and then we can have some more discussion. Oh, you're on mute, Denise.
The next one, and I'm going to go quick over these two, community anchored workforce engagement. We want to try and get you all to share some feedback. This one has to do with investing in the CHW model and looking at bridges between community health workers and navigation, and how they align with ECM and CS services, and where we might be able to integrate into workforce and into healthcare provider teams. And so we've got some ideas here, some questions. Does anybody know, are there CHW ECM pilots taking place today?
So not necessarily a pilot, but we have in child welfare, we have basically ECM being done by public health nurses for some of our foster youth that are prescribed psychotropic medication. And they work really closely with a CHW who like manages appointment scheduling and stuff like that. So they would be really great contacts if this is something that you want to look at, just in terms of working together. I don't know if that's in the same line of what you're thinking,
so,
but
Hannah, as a follow-up question, so in the scenario that you're describing, the community health workers, they're not ECM providers themselves.
no,
Okay.
but they work really closely with the public health nurses who are the, ECM providers essentially.
Okay.
But it could be, I think we've talked about internally, like with our public health department, like how that might look if we were going to change it. So they would be, I think, good resources if you wanted to talk to somebody about that.
Yeah, I think that sounds great. We won't go through the rest of these. We'll scoot over to the next slide. But Hannah, that's exactly what we're looking to do, kind of talk a little bit more about that. And Jonathan, I see your hand is up.
Yeah, just a quick question. Out of curiosity, does Intrepid Ascent collaborate with other facilitators like Transform Health and all the other Path CPI facilitators? Because I feel like maybe a more direct example in LA County, for example, the health plans there are working on a proposed incentive program, and they're kind of designing something around CHWs, increasing intake, sharing resources for training. And so I'm curious if you guys, there might be other facilitators in other regions that have these similar questions, and I'm curious if there's like any coordination that you guys can do or are even able to do on your level as the facilitators.
Yeah, absolutely. So yes and yes. We don't always know every aspect of what folks are working on in other counties. We try to come together and share where and when we can, and to a certain degree what level of engagement we're working on, different priority areas of focus. This is really important in our community. And also learnings from you all on different things that you're hearing about in other communities. And so as a result, Jonathan, I can scoot over to the contact that we have for the facilitator for LA County and have a follow-up conversation with them about this very thing and see if we can learn a little bit more about what they're doing.
Sounds great.
Okay, one more, and that is next tab, streamlining and efficient referrals. So to some degree tied to that first one, which is thinking about a place for which this data can sit and be viewable for transparency's sake and for collaboration. And this is thinking about streamlining and creating efficiencies and referrals, closed loop processes across payers and providers, and looking obviously at other data around capacity and standards as it relates to each of the different managed care plans. Jonathan, another note here, this is also not an uncommon topic across the state. So this one in particular, we're hearing sort of statewide in different areas. To a degree, some solutions could be similar, and we can talk a little bit about what we're hearing from other groups. In other areas, the situation and the solution might be really different because the landscape is different. The community is different, right?
Definitely. And just a quick additional note, I think even at the state level, there's been a lot of discussion recently from DHCS about how maybe some of the differences in which the different Medi-Cal managed care plans are running eligibility and authorizations are creating access to barrier. And so I think the state has suggested that they're going to be supporting that in the future, kind of going forward. So this priority is really well timed. I think we've seen it across other counties as well. And I'm hopeful that with some support from the state, we can continue to have some more streamlined guidance. So this is really well timed.
So just wanting to kind of continue the conversation, talk a little bit about these three areas and some of the next steps that we might be able to take. From the group, any thoughts? Do these feel misaligned from our earlier conversation? Like, are we talking another language? Do these also, make sense to you all, and they're something that you're interested in working on?
I think it still sounds very beneficial and like it would help to create a lot more transparency than there is right now.
Are there any, so just stepping back, Rachel, and looking at the three areas, and we can toggle back and forth if we need to. But is there anyone in particular that stands out? It sounds like you're interested in the in the sort of status tracking that we talked about for the tab 1 priority one, in that, hosting that internal site that will get maintained over time, capturing capacity and, ECM and community support contracting statuses, what services are being provided by which providers. Anyone in particular that you're leaning towards?
Well, I'd like to be transparent about the fact that my organization is currently in contracting conversations to become probably an ECM provider. So that first category is most interesting to me, but that's coming from a very specific, like where my organization is within the process place. So I definitely don't want that unique position that I'm in to override the rest of the group or anything like that. But yeah, for sure. I think that's the thing that would be most beneficial from my standpoint.
Okay, and that's valid. Anyone else want to share thoughts? We are very much hoping that we'll land on one, priority area to focus on over the next several months. So it'd be really great if you could share your perspective, and so that whatever is decided on, has the potential to really benefit and impact your organization. So we'd love to hear from you.
And just to clarify too, we're not saying to you, hey, which one of these things do you want to work on? And oh, by the way, can you take the lead to do all of the work? By no means is that the intent. We really want to just kind of have a conversation about what do you think is the most important and the most likely to happen? Like, oh, it would be super great if we could do this, streamlining referrals, but I don't know that we'll be able to, as a group, really facilitate that change and make that happen in the next, 3 months, in the next 6 months. And so, so the first thing is, no, we're not asking you to take the lead. We're asking you to, let us know what's important to you, and we will work with you and this group to continue to advance that and move it forward. So just, sharing feedback does not automatically sign you up to chair and take the lead on this.
I'm sure that that was an important clarification. And when we talk about this group, it's not just this group of 20 that we have here today, but a lot of the larger collaborative, the 100 or so stakeholders that are part of the Contra Costa collaborative, are waiting for a decision to be made on what we're going to actually work on. So once we decide on the one area, we're gonna re-engage the larger group to see who is interested in helping inform this work and engaging in this work and defining this work. So it's not just all on this group here today. Just wanted to clarify that as well. Yeah, so please share. We have some time. So anything positive, negative concerns, this is the time to have a chat. And it's a small enough group where we could just, do it collectively.
This is Alana. I think from my perspective, the priorities around the referral systems and really fortifying those and ensuring that folks really know how to do that, understanding who's in their network is something that's like a top priority. I think we've done a lot of work to try to build out the provider network, and now it's really understanding the referral network. And so we're trying to tap into that increasingly. So it'd be really great to kind of leverage like this group to better understand what are those touch points, how we're interacting with them, how we kind of can think about like where potential, members who are eligible for ECM are interacting along continuum of care, so that we can kind of make sure that they're getting referred appropriately, and kind of who are those different stakeholders in those conversations, and how we appropriately kind of modify our conversations, think about, outreach engagement to really make sure that they're in the conversation. I would say though, I think with the kind of conversation, and I'm interested in understanding more when we talk about streamlining and kind of like alignment and activities, I would say from Anthem's perspective, that might be hard, and wouldn't necessarily set a fair expectation to think that we can get 100% alignment, obviously, with Contra Costa Health Plan, for a variety of reasons. Kind of focusing on this referral networks, and I think kind of mapping those processes would be helpful.
Yeah, thank you. Go ahead.
That could, and if this was the route, we would take, that could be a potentially sort of first phase of the work. It's just mapping out what the current network is like, and really documenting what the referral process is like before we even improve it, just, capturing what current state is, and then the next step, making some decisions about, streamlining it. So, so that was a great, potential scenario if we were to go this route.
Just to add a little bit more to that, this is again Jonathan, and just to clarify, I'm sorry, I probably should have started out with this, but just to explain for folks who don't or are not familiar. So Kaiser Foundation Health Plan, kind of the health plan side of the Kaiser Permanente ecosystem, we are a delegated network to Contra Costa Health Plan. So we contract with Contra Costa Health Plan, and we see a portion of their members, and so we do ECM, and we both do some community supports like through our network, and then we refer back to Contra Costa Health Plan for other community support services. So the relationship is a little bit nuanced, but Contra Costa Health Plan is our prime managed care plan that we contract under. So I know that may be a little bit unclear. If it's clear, please, or unclear, please let me know. What I wanted to just tack on to this is I think that third bullet, how does this tie into the capacity/network map, is really, really important. I think across the state, we've all seen surprisingly slow uptake of ECM and community supports. And something that I've heard in a lot of other collaboratives from some providers there is, it's great that there's interest in contracting and it's great that these resources are being developed, but as a provider, and especially a smaller provider, is it worth it to go through the administrative process of contracting if there aren't any members that can actually be assigned to me? And so I think we can't just look at the referral system. We have to kind of look at like, what are the inputs and what are the outputs? And part of that input needs to be, is there a large enough population pool to substantiate additional providers coming online? And again, the state is also looking at ways that they can partner with the managed care plans to really increase the uptake. So I think there's opportunities to like tie all these things together and working towards maybe not what a solution looks like in the next like 30 or 60 days, but like by January of next year, like these are all the things that can happen to like look at all those different inputs, outputs, support the providers, listen to the managed care plans, take the guidance from the state. So this feels like a really complicated, but potentially really effective priority focus area. Again, with the understanding that it may not be entirely possible for all the MCPs, for all the managed care plans to align on how they do authorizations and how they do referrals, but anything that we can do to like look at the entire like system, I think is going to be helpful for everybody, not just us as MCPs, but also for providers to really make an informed decision about, is this worth it for me? And like, what's going to be coming in like January 1 of next year? Maybe there's more, maybe there'll be a greater need in the future. Like, how do we prepare now for tomorrow in a way that makes sense?
Yeah, I think that's a really excellent point. I think, I sort of think about solution. I'm sort of setting the idea of a solution on a shelf to some degree, because I don't know, like you said, it is complex, but it's going to be hugely beneficial. And I think in order for a solution to be there, like you said, Jonathan, in January, or get to that place, we need to do some other things first, right? And so what could we do now that could help inform a solution? Is it just mapping out the variability in referral process? So aligning where MCPs have the same process and identifying where MCPs have a different process. So the output, that what we would end with as in a result would be like, here's the managed care plans, here's all the things that are the same, and here's the 3 things that are different. And you need to, as a service provider, know that when you're making a referral specific to the member that you're serving. Would that be helpful or no?
This is Lauren. I'm from Health Blades, but I've been supporting the IA team in these facilitations. And I just wanted to offer an outside looking in and kind of flip it on its head a little bit, just to give a spectrum of ideas here. But given everything that Jonathan and Elena, I'm sorry, I always mispronounce your name, just offered, you could do this from the other side too, of like, what is our ideal state? Thinking about centering the client and centering the providers who are advocates and allies of the client. What is our ideal state of streamlined and efficient referrals? And then, like Jonathan's offering, how do we acknowledge the inputs and outputs and crooks and crannies that make that ideal state not current state? But there is, to the point of like, this is about piloting. This isn't about stepping into this with a solution in mind, but designing together and figuring out if what we design together can be a reality, it has impact. you could also do it from that perspective. And I'm offering that also because I'm super conscious that we are doing that capacity and network map, which is going to be the capacity, which is going to give us the current landscape. So there could be a real benefit to letting that be the current state approach and taking an approach to this one that is more ideal state design forward, and then looking at the space between those two things. So I'm not trying to put my finger on the scale in any way, but just wanted to offer that as another angle for which to think about these things. And to Jonathan's point of like, to what end are we doing this? Well, you'd walk away with something designed that then we can say, is it viable or is it not?
Are there any other thoughts before I summarize what I think I'm hearing? So what's been talked about so far regarding these 3 slides, and again, if you want a recap, we can toggle back and forth. So the first, the priority under the first tab is focused around developing that, community-based site where there's capacity information, service type information that will be maintained over time, which will help with referrals. But this one in particular, around referrals, will also require a current state network map, but not necessarily require maintenance over time. This focus area that we're looking at is really going to be focused around, once we know who the providers are, how to streamline that referral process. So those are the 2 that I'm hearing being talked about and being considered. There's less of a focus on the second one around community health workers and and looking to that model to incorporate into the ECM and community supports model. So the first and third, and there's a distinction. There's a network map component to both, but the first one is more around really establishing a central place and a standardized way to gather that information and maintain it over time, to help inform who the providers are and what the capacities are. And then here it's more about the referral process, and it could have a network mapping component to it, but at a minimum, just current state right now, and then really focusing on the referral process. So that's what I'm hearing. If I miss anything, feel free to speak up, but those are the 2. And if we were to select one of the 2, does anyone have any opinions about which one would be more valuable and feasible to do in the next 6 months? Hopefully that'll compel people to step in if we have to choose one or the other.
I have a question. Can you circle back to the first one that you mentioned around the host site? Because, I want to recognize that, community health workers are like very important in this conversation. I think, we're just trying to understand how to optimize that model, and we're early on in our process as far as getting contracting off the ground. But I also know as far as the plan's priorities, especially with our incentive payment program, increasing that workforce, identifying ways to get folks integrated into the model is a high priority. I think CHWs are going to be critically important for really getting people in moving them into ECM and kind of what we outlined. So yeah, I'm just trying to, I guess I would, and I'm also just, I guess once seeing the survey will be helpful, because I'm also just trying to understand kind of, and this is just maybe an audit that we need to do of what is it the state that currently, what are we currently collecting as required by the state? And they should already have that information. What are we just collecting from Anthem's perspective as far as just for us to better know our network, because we are asking some of these questions. And then, you know, and I think like one of the hard things, one of the areas of opportunities is like, I think in some respects, we understand our network of providers and are asking these questions about capacity, areas of opportunity for growth into these new like ECMCS. We don't universe of people who are outside of our current like identified folks. So I think like leveraging from that perspective would be super helpful, is like understanding that additional universe. Because I think, and maybe some of the other contractor providers would disagree, but I think we do ask a lot of these kind of like questions. There's some things like very nuanced that we don't necessarily have. I know the geography question came up, and kind of, you know, in general, we, you know if they service the entire county, or, you know, those type of things, or if there's like a specific area of focus. But I think to kind of summarize what I'm trying to say here is, with respect to point number one here, I think just getting a better sense of kind of like what those auditing what the state asks, what we asked, and what you all are intending to ask for this, I think would just be a good exercise, just to make sure that we're not duplicative, and seeing if we already have that information coming out in some way or another. And maybe we just need to represent it to this group, as opposed to kind of reinventing some of these like other survey mechanisms, et cetera. And then I think with the CHW conversation, I don't want to, from my perspective, from the player perspective, is not to push that down, not necessarily as a priority, but I think it's just kind of, it's in a newer phase. And I think we're just trying to understand how to kind of like optimize them into some of these models. And so it's a priority in that sense. It's just like, it's newer on in the process. And I can reach out to some of the people in LA County, because I know we're represented there, just to kind of see what some of those conversations have been. Yeah, just wanted to add that in there.
I think that's great. So just to kind of circle back on that, what I'm hearing is one way that we could think about, if we were to design something, if we were to kind of think about what this might look like or be, Alana, what you're saying is it would be good to just kind of take inventory. What are all the things we're asking Sarah and Rebecca to report on, to give us as a managed care plan? And then what are all the things that we need to, as a managed care plan, collect and report to the state? And so if there's some ways that we might be able to think about that and incorporate that into, some sort of a either, a central place, right? So we're not asking people for this data in a different way in different times. So where we could simplify or collaborate on data collection. Is that right? Is that what I'm hearing?
Yeah, that's what I'm trying to, because yeah, thanks.
No, that's, I want to check for my understanding too. I think that's doable. Like, that seems like something we could do together. Like, we could ask, even if it's just 15, 20 minutes, like what are some of the things that you have to report on a frequent basis? Absolutely. I think that's something that we could work on. Any other thoughts?
Yeah, we're nearing the end here, and we're going to ask the group. I'm going to put some instructions into the chat so that we can vote on one or three. And again, these are all priorities that have been identified by the larger collaborative. So don't feel like we're, if we choose one or the other, it's not going to be properly represented. They're all priorities. It's just choosing which one we want to focus on. And again, it's not that we're trying to solve these issues within the next 6 months. It's what we want to work towards. And this is all, again, connected to the overarching goal around increasing ECM and community support services that we've identified way at the beginning. So it's all connected. Any other thoughts while I put the instructions into the chat?
Thanks, Sokim. And Lauren, I'm just going to ask you to advance the slide a few more to just talk about some of the things that are coming up next. And if you guys look at what Sokim put in the chat, and I'm going to kind of parrot back what I'm hearing. It sounds like there's an opportunity for us to streamline these a little bit more and connect them. So there's some of that data collection ties to some of these priorities, but they align more than even than I think initially we thought. So maybe one thing that you think you'd be interested in collaborating and providing feedback and helping design. As you all put your responses in the chat, upcoming communications, we're going to work on what Danny mentioned earlier around that network landscape assessment. And we'll also take some of the feedback from the prioritization, and we'll try and take it a step further. We may ask you to just validate what we're hearing, because I may not be hearing what's really going on. You guys are living this every day, so sort of taking the opportunity to do some of that validation. And then we meet again in the middle of July 19th. Last but not least, Emily probably sent you all a survey, I think it was last week. They went out to all of the collaborative participants. And this is really just a more general survey. Tell us how we're doing. Tell us what you hate about this collaborative. What could we be doing better? How might we be bringing you information and moving this forward? What is your ideal way of collaboration? We want to know, good, bad, or otherwise. That information that you all share can be used to continue to move this collaborative forward for the rest of the year. I'm feeling like we're all talking a lot and I'm not getting a good bit of feedback from you guys. I want to thank Alana, Jonathan, Rachel for sharing. Let us know if there's different folks that you all are working with where we might be able to get some additional feedback from them as well.
So if you all, before you drop, I did get some responses directly. So if you want your response to number 1 or 3 to be anonymous, you can feel free to send it to me directly, and then we'll capture your response and we'll share it out with the group. Okay, so far collectively, for those who sent me the responses directly and also we shared publicly, it seems like we're leaning towards 3. So thanks for everyone's input.
Thanks so much, everybody. We'll circle back with the group, share everything from today, and excited to get started on designing number 3 a little bit more and getting some questions and answers. So excited to keep moving things forward.
Thanks, everyone. Appreciate it. Have a great day.
Have a good week. Thank you.